Hello, and welcome to Pearl Magazine. 55 million people around the world now suffer from dementia. By 2050, the World Health Organization predicts that number to soar to 139 million. There is still no cure for the illness, but scientists at the Hong Kong University of Science and Technology have come very close to one. Pearl Magazine's Ambrose Lee finds out how their recent discovery of a genome editing technique could potentially cure familial Alzheimer's disease once and for all.
做運動好冇啊？我哋夠鐘做運動，好啊！我哋揾 bench 嚟做運動。
I'm Man, and I'm a carer for my 98-year-old grandmother who suffers from moderate dementia.
4 years ago, Man's grandmother was diagnosed with dementia. They now live together with Man's parents and a helper. She says that because of the disease, everyone in the family had to relearn how to communicate with Grandma.
As simple as communication, we noticed the elderly with dementia are quite stubborn without even realizing it. If we carers insist on certain things, it might make everyone unhappy. There were a few times when our helper wanted to bathe Grandma, but she wouldn't cooperate like she usually does, and then she started throwing tantrums.
Man said she told her helper to try distracting her and not insist when the bathing must happen, and try again in 15 minutes or so. So far, the tactic has worked.
Because of dementia, Grandma's character and habits have changed, and she could no longer control her emotions, especially with those around her. With this in mind, we have to work out how we communicate with her. Her short-term memory is not very strong, but she remembers her old habits quite well. She used to buy groceries when she was young, so she knows this is cash and knows the importance of identifying and counting it. This activity helps train cognition and her muscles. It doesn't matter if the sum is wrong. I just want her to do something and to stimulate her brain.
As Man works hard to look after her grandmother, her concerns for the family loom large.
Of course, no one knows how much of this is hereditary yet. Even if it's not, I'm still worried for myself and my family. What will happen if one or more of us has dementia in the family?
In Hong Kong, 20 to 30% of seniors aged over 80 suffer from dementia. Dementia is a syndrome that leads to deterioration in cognitive function beyond the expected usual consequences of biological aging. As the population ages, it's estimated Hong Kong could have as many as 280,000 dementia patients by 2036. While there is no cure for the illness, researchers at HKUST have recently made a breakthrough discovery.
Genome editing uses advanced technology to modify the genetic materials in living organisms. So we can delete, insert, or replace specific genomic segments of DNA. We actually use genome editing technology to ultimately correct the mutations in familial Alzheimer's disease.
Alzheimer's disease is the most common form of dementia and accounts for 60 to 70% of cases, according to the World Health Organization. In this recent study, led by Professor Nancy Ip, her team of researchers targeted specific mutations that cause familial Alzheimer's disease, which accounts for 500,000 patients in China alone.
For this group of familial Alzheimer's diseases, it's known that there are specific mutations that result in those diseases. So we use the genome editing technology to correct these mutations.
There are 4 key features to this scientific breakthrough. First and foremost, the ability to overcome an invisible wall between the body's blood circulation system and brain cells, the blood-brain barrier.
So the blood-brain barrier actually separates the periphery from the brain. If we want to target the cells in the brain, the treatment needs to have the ability to cross the blood-brain barrier in order to have access to the brain cells. So the genome editing system that we have developed has that ability. So it can target the brain cells that need to be corrected.
Yeah.
Right.
And previously this wasn't possible.
That's right.
Another key feature is easy administration. By using genome editing technology administered by an intravenous injection, the blood-brain barrier can be crossed so that it can correct targeted brain cells across the entire brain. The third key feature is the ability to treat the entire brain, a procedure not possible in existing open brain surgery, which targets localized areas.
It is important to develop a technology for the entire brain because some brain diseases affect multiple regions in the brain, such as Alzheimer's disease. So it requires a technology that can correct the mutations in a brain-wide manner.
The fourth and final feature is the lasting effect of the treatment. In their research involving laboratory mice with one injection, the conditions characteristic of Alzheimer's disease were ameliorated and cognitive deficits could be repaired. The effects lasted for 6 months, roughly 1/3 of a mouse's lifespan.
What you see here, section of the brain, and the white dots refer to the major pathological changes in the brain of the Alzheimer's disease transgenic mouse. This is without any genome editing. This is after genome editing. And you can clearly see that the white dots are much reduced. So genome editing can effectively ameliorate the pathological changes in the brain of the Alzheimer's disease mouse model. It is promising. I would say it gives us a lot of optimism, I would say, to have it also working in the human.
But Professor Ip says it could take another 5 to 10 years before the technology can be tested on humans. She says the same technology could be applied to cure other neurodegenerative diseases such as Parkinson's or Huntington's. Skeptics, however, have questioned the use of genome editing on humans on ethical grounds. Professor Ip says the technology would not cause changes to the genes of a patient's children.
The technology itself would not affect the offsprings because the technology simply is just correcting the mutations in the brain of that individual. So it would not have that issue at all.
Professor Amy Fu has worked with Professor Ip on neuroscience research since 1993. She is one of the researchers on this project.
I think we can say that it is a milestone, as this is the first time showing that the genome editing can reach a high efficiency in the animal brain. So this definitely provides a strong experimental evidence to show that we can use the genome editing approach to develop the therapeutic strategy for the brain diseases that are caused by genetic mutations.
While the development for an Alzheimer's disease cure is underway, the lab is also devising a blood test that could be used as a definitive diagnostic tool for the disease with 96% accuracy, something that has so far not been possible.
Numerous studies have reported changes in the brain 10 to 20 years before the individuals have some clinical symptoms, such as memory impairment. So these changes in the brain, we believe, can be detected using our blood tests.
Existing tests involve testing one's reflexes, coordination, eye movement, speech, and sensation. Professor Ip says the blood test shows changes in blood plasma protein levels, an indicator of the onset of Alzheimer's disease. The research team developed a system that could identify 19 plasma proteins out of the 429 plasma proteins associated with Alzheimer's disease. Once identified, the system can determine what stage of the disease the patient has.
It is simple. It requires a small volume of blood. The accuracy of our blood test is over 96%, and we can get the result within 3 days.
She says the blood test marks a major leap from existing diagnostic tools. These tools include the Montreal Cognitive Assessment, which relies on subjective evaluation, lumbar puncture, which requires surgery and is invasive, and brain imaging, such as a PET scan. Such tests can be costly, but Professor Ip and her team are hoping their test would cost no more than a few hundred Hong Kong dollars.
We believe that the blood test we have developed can be used at a population scale. And I hope that one day it will be included as part of an annual blood test for the population.
In addition to early diagnosis, the blood test could also perform other functions.
If an individual is at risk of developing Alzheimer's disease, he or she can take the blood test on a regular basis and monitor how it changes over time.
By monitoring one's progress and making lifestyle changes accordingly, regular blood tests could help to slow the progression of the disease. It could also help test the efficacy of medication for Alzheimer's disease.
Pharmaceutical companies can use our blood tests to show that after taking the drug, actually the profile of all these proteins in the blood, they change, right? The blood tests that we have developed actually has huge potential, not just in terms of diagnostics, but also in terms of developing therapeutics.
Of course, if the day comes when it can be completely treated and it doesn't take a huge toll on the patient, we are willing to give it a go.
Man says not only is this great news for the patients, but also family members who must spend a lot of time doubling as caregivers.
Once they know a family member suffers from dementia, they have to embark on caretaking immediately. This could potentially mean sacrificing one's job and income. However, if I do a test which, for example, tells me that I'm likely to suffer from dementia, then I could start working out how my financial plan, my health plan, and my career plan pan out. For an elderly person like her, we just wish for her to be happy, which would definitely help with her mental and physical health. Grandma is already 98, and no one knows what the future holds. I really treasure the time I can spend with my family.
After the break, a look at how dementia patients are being cared for at home and at elderly care homes in Hong Kong. Stay with us.